Really excited to share our research with you today, looking at, again, the socioeconomic disparities and long-term heart failure in patients with early stage breast cancer. And so essentially what we did is we used the SEER-Medicare database, which is a very large database that contains data related to the diagnosis and treatment of breast cancer for hundreds of thousands of women in the United States. We're able to connect this data with available census data. And first, we looked at the incidence of some kind of higher risk clinical features for early stage breast cancer among different socioeconomic groups. What we were most interested in were kind of larger tumors, higher grade tumors, more advanced nodal involvement. And then next, we made a multivariate analysis model where we were able to look at, again, the long-term incidence of heart failure among these different socioeconomic groups after controlling for some cardiac comorbidities that were present and the type of treatment that was received. And essentially what we found was that going back to those kind of higher risk clinical features, we found that, as expected, certain races, ethnicities, and other socioeconomic groups were at higher risk for having these higher risk clinical features. So specifically, Black patients, Hispanic patients, American Indian, Alaskan Native patients were all at higher risk for having, or I should say, had increased incidence of larger tumors, T3 to T4 tumors, more advanced nodal stage, so N2 to N3 tumors, and higher grade tumors, so grade 2 or 3. Other groups that seem to be at increased risk for these higher risk features were patients who were living in zip codes with particularly low per capita income, or PCI, those in zip codes that had a larger percentage of the population living below poverty, a higher percentage of the population that was not speaking English at home, and lower levels of overall education. And then looking at our multivariate analysis and the incidence of heart failure and risk of heart failure among these groups, we found that even after controlling for cardiac comorbidities like hypertension, coronary artery disease, diabetes, and even further controlling for the type of treatment received, so anthracyclines and Trastuzumab, which we know, of course, are associated with increased risk of heart failure in these patients. Even after controlling for those factors, Black patients were still at an increased risk for developing heart failure over the period of the study. It was about a 10-year period. And then looking at some of those other socioeconomic groups, after further controlling for race, specifically patients who were living in an area with low per capita income, or PCI, were again at a higher risk compared to those other groups for developing heart failure in the long term.